Hello and welcome to Sensei Podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei Podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello and welcome to the Sensei Podcast. It is my great pleasure to introduce you today our guest, who is Dr. Alexandre Quadros, who is the coordinator of the Latam registry, Latam CTO registry in Latin America, and also the director of cardiology at the Instituto de Cardiologia de Rio Grande do Sul. So Alex, thanks so much again for joining us today. I'm super excited to discuss with you about your learning process in CTO PCI.
Thank you, Manos. It's a great honor to be here. Thank you very much for the invitation. It's very important for not only for me, but for every CTO PCI operator in Brazil and also in Latin America.
Oh, thank you. So, Alex, tell us a little bit about yourself. How did you get involved into CTO PCI? How did you get to do it? How did you start the Latam? I mean, so many things to discuss, but maybe start with how you became interested in the area of CTO PCI.
Okay, so I graduated in medical school in 1988, so I'm a little not so young, and I started interventional cardiology in 1992. So for many years we were used to fail at CTOs. Most the success rate in Brazil till the 5 or 10 years ago used to be 50-60%. So CTO was always a problem for us. So in 2015, when I went to the TCT, in that TCT they had like a crash course on CTO PCI, and I remember you talking and teaching about the principles of CTO PCI and the hybrid algorithm. So that was a changing moment for me, because at that point I learned that CTO could be treated, and we could change the life of those patients that had like only one artery that would not qualify for surgery and had very significant angina. So at TCT, I learned that CTO could be treated with a very high success rates. And then in 2016, I was the scientific director of the Brazilian Society of Interventional Cardiology. So we started courses in Brazil. The first course was the CTO Summit Brazil in 2016, and then we invited Dr. Stefan Rinfrey and Dr. Daniel Weilman and Dr. João Bruno Silveira from Portugal, because we realized that in Brazil, at that moment, there was no one who could give a talk about CTO PCI. So we had to invite people from abroad, and all the 20 talks were done by those guys. And we had a very, very big audience, 150 interventional cardiologists that were interested in CTO PCI. And in that first meeting, we also asked people if they would be willing to participate in a registry. So most people would. So at that first meeting, we also started the Brazilian registry of CTO PCI, because we realized that CTO PCI would start very strongly in Brazil, and then after we expanded the registry to Latin America, and now we have the Latam CTO registry for more than 3,500 cases from all the continent. So my start in CTO PCI was doing the cases, and also in this endeavor as the scientific director of the Brazilian Society.
Wonderful. Again, congratulations. I mean, that's a huge accomplishment. In a few years, you have a robust CTO programs. You do have many operators who are doing excellent quality work. So congratulations for getting this started off the ground, and the great service to people in Brazil and in all over Latin America. Now, in the local environment? I understand that there's some limitations in terms of equipment. Patients do have disease. How were you able to overcome those limitations? Were there some things that you had to improvise, do things a little different than other countries maybe would do? How were you able to adapt the CTO algorithms and techniques to the local environment?
Yeah, at the beginning, we counted with the help of proctors. So the proctor that helped us most in Brazil was Dr. Daniel Weilman from Switzerland, because he had also a connection with Brazil. His father used to live in Brazil, and he also could speak Portuguese. So that and also the friendship of Daniel, and also the willingness of him to coming to Brazil several times a year, not only with me, but with other people interested in CTO PCI. So that was one important point to start the procedure. So at the beginning, some proctors would bring equipment with them, would bring wires and catheters, microcatheters. So, but not always. So we had also to improvise and use like similar wires to the same purpose as the regular CTO PCI wire. So that was a little tricky, because we had a very difficult procedure, and also we could not have the best equipment to perform the procedures. And in the public health system in Brazil, we have some limitations regarding equipment, but when the patient has a private health insurance, we have more room to use advanced equipment. So we have those two realities here, not only in Brazil, but I believe also in Latin America.
And then how often do you actually treat CTOs? Is this something very common? My understanding is the health style might be a little better in Brazil. People are more active, maybe they're exercising more, being more active overall. Have you seen that? Is that CTO something fairly common in the patients that you treat?
No, I believe that most CTOs, as you know, they don't have. We don't have to open most CTOs. We only indicate the procedure when the patient has significant symptoms that don't improve with medical treatment. So in my practice, maybe one or two CTO PCIs per month. I'm not a proctor of any company. There are some guys in Brazil that are, so they travel a lot and they help a lot of people to do the procedures. In Brazil, we have a reality that most operators here, they have very high volumes. So most interventionists in Brazil, in my center, for example, we do like 60 procedures each day. So not only PCIs, but CATs. So we have a very large cardiology institutes in Brazil. Brazil has a population of 250 million people. So a lot of people to treat. So many guys, they are very experienced and they want to do CTO PCI also. And many easy cases they can perform, and when they have more difficult cases, they will call a proctor to help to do like retrograde or ADR. So the reality here is not for example, in Europe, that you have dedicated CTO PCI centers that receive a lot of referrals from other interventionists. Here, many interventionists, they want to do the case. So we don't get so many referrals like I believe in Europe and in the US maybe.
Wonderful. And then in terms of the procedures, how is the planning coming along? Is it reviewing the angiogram, talking to the patient? Is there anything that you do that has evolved over time that you're now doing to help you be more successful and target the right patients for the procedure?
Yeah, this is a very important point, Manus, also for people that want to do CTO PCI. I think that reviewing a very thorough review of the angiogram is very important to understand what you can gain from the images, and you also have to understand that when you do the dual angiography, you are going to get much more insight about the CTO, mainly the length of the CTO and also the filling of the collateral. So, but the first is to review the angiogram and to prepare yourself to to do the case, to have enough time to do, not to rush into the procedure. I think that in my practice, I always call another experienced interventionist to help me. I think that this type of procedures, not only CTO PCI, but complex PCI, it's important that you have a partner, not a partner to help you in difficult situations and to give you some insight. I can remember the example of Simon Walsh and Colm Hamrati, that they always use it to work together. I think that is a very important example. And also to review the equipment that you have, the wires, the balloons, the catheter, to get prepared for everything that can happen during this type of procedure.
Wonderful. And actually, as you said, there are many other places where having two operators really helps everyone feel more comfortable, even when things go well, but especially when there is a challenge or a complication. It's very nice to have a second experienced operator that can take care of that. Now, in terms of the learning process, which things did you find the most difficult to learn in terms of CTO PCI? Was it the undergrade, the retrograde, the wires, the equipment? Is there anything specific that you found that was most difficult to learn in the environment of Brazil and Latin America specifically?
Yeah, this is a very interesting question, because for me it was the reverse card. I could not understand how the reverse card worked. I had to read a lot and see a lot of cases to understand how to do the reverse card. I believe that for many people this can be also the most difficult part of the process. But I think that learning about collaterals, which collateral to approach, and when you have to try a little more, and then you have to give up that collateral and try another one, and understand when your wire is not in the right position. I think that CTO PCI is a very, very difficult procedure, and you are always learning, and you have to do a lot of cases to achieve a good level of expertise.
Wonderful. And then, do you get stressed out? Do you get anxiety when you have these procedures? Are those now fairly routine? How do you feel, you and your partner, when you do the cases, when you tackle these often complex procedures?
Yeah, I feel a little anxious when I have a very difficult procedure to perform. I think it's normal. But during the procedure, we used to be calm, try to be calm, and not to rush the team or blame anyone if a complication develops, because this doesn't help anything and doesn't help the patient. So we have to remember that everyone in the room is there to help. So the better thing that you can do when you have a complication is to stay calm and think about what you have to do and what you can do. And I think that one important point that I learned from the lectures is the complication generally is not the first thing that you do that will harm the patient, but generally the second and the third. So the next two things that you are going to do that will make the difference. So when you have a complication, you have to stay calm and not to rush to do to follow your first impulse and do something that you are going to regret after. So you have to think about what you have to do next.
Absolutely. So think first, then act. I know sometimes people say if something very major happens, act first and think second. But I think for most cases, it's best to think, then act, because as you said, if you take the wrong route and one thing follows another, then the risk of having something more severe goes way up there. How worried are you about radiation? You do, as you said, you do so many cases.
Yeah, I'm very worried about radiation. I know that a lot of guys are not. We now have the Rampart system, right? But in my hospital in Brazil, actually, I spoke with them 2 weeks ago to trying to bring the system to Brazil because they don't have yet a distributor here. but it seems that they are struggling to find someone to represent them in Brazil. But I have the lucky to work with Philips, the last model of Philips that has the Clarity system, and I have a very good experience with this equipment, because I can last month I did a bifurcation PCI with only 60 milligrams of radiation using 7.5 frames per second and a lens of 31 centimeters, and optimizing all the equipment. So this Azurion 7, the late model from Philips, is I think it's a very good advance in protecting you and the patient from radiation. And we also have the robotic PCI that is coming to Brazil. There are some hospitals that they have the system. In here in my state, we don't have a robotic PCI yet, but I think it's another important thing for us, not only for radiation, but also for orthopedic reasons because of the lead apron.
Perfect. So, Alex, as you said, you've spearheaded the Latam CTO, which is providing a lot of insights on how these procedures are done. How did you develop this? How did the idea come to you? How did this, it's a big operation to get a registry of that magnitude off the ground and get the sites to contribute. So how were you able to do that?
Yeah, well, I was always interested in research. I'm a professor at two universities here in my city. So from the beginning of my career, I used it to be a doctor and also a researcher. So when I started those courses in Brazil, it was natural for me to think about a registry, because it would be we would start doing a different thing, and I would like to see what that new endeavor would come. So we started, like I mentioned before, in the first CTO Summit Brazil. We asked people if they would be willing to participate in a registry, and most of them would. So we started a Brazilian registry, and then with my very good friend Lucio Padilha, we expanded the registry to Argentina. And then the guys from Mexico came, and then from Chile, and then from other countries. So I have to mention some guys here that are very important in this Latam CTO registry, like Lucio Padilha, Ricardo Santiago from Puerto Rico, Mario Araya and Luis Perez from Chile, Marco Alcântara and Mauro Echavarria and Felix Damas de los Santos from Mexico, and from Brazil, João Tinoco, Antônio Botelho, Carlos Campos, Evandro Martins Filho, Marcos Danilo, so Marcelo Arada. So a lot of guys that are very good operators with a very large volume. And we could gather them, because I don't know how, but we could gather all these people. And in my hospital, Instituto de Cardiologia, the hospital was a great partner, because the hospital provided all the personnel to start the registry and to help to collect data. I have a fellow, Pedro Pícaro, who is the coordinator of the Latam CTO registry. Boston Scientific was very helpful in giving support for us since the beginning. Other companies like APT, like Terumo, like Asahi, and the Brazilian Society of Interventional Cardiology also helped a lot at the beginning, funding the registry also. So it was something that we started small and grew very, very fast. We have all the data from the Latam CTO registry in our website. It's latamctoregistry.com. If anyone wants to see the data, it's it's updated real time from the database, the RedCap database. So for every case that we put in the registry, it will upload in the website. So it's very interesting to see how things are going in Latin America.
Yeah, and again, congratulations for that. And I know you published many nice papers on various techniques being used on previous bypass patients. So a lot of specific subgroups showing very good results, for a recent started program. So clearly you're doing it the right way with the proctorship and building the programs very solidly. So how now people who want to do it, let's say it's a new operator in Brazil or any other part in Latin America wants to learn how to do this. Is there a process? Does he contact you? Does he get some proctors? Does he go to meetings? How is the process? What is the process for someone who wants to learn Latin America to learn and get good at doing CTO PCI?
Yeah, we have those summits, CTO summits that are sponsored by the Brazilian Society that will happen once a year, generally in October. So this is a very good start to attend one of these CTO summits Brazil. And there is also another summit that is sponsored by my very good friend João Tinoco in his city Linhares in Espírito Santo, that he developed the CTO Club Brazil. This is a more focused event on live cases. So we would perform like 8 live cases in 2 days. This is a 2 days course. So this is also a very good option. And Lucio also has his meeting in Buenos Aires, which is another option. Ricardo Santiago also has a meeting in Puerto Rico. And the industry in Brazil is helping people, because when they ask for like different wires, or they are interested in doing a CTO PCI, they will bring proctors to their hospitals, and this will start the process of bringing people interested in CTO PCI, because when you have a case that you cannot solve, this is the better way to understand that you have to learn something to help your patients.
Wonderful. And then, so Alex, you do so many things, right? You do the clinical work, you do work on the registry, a lot of things. How are you able to keep up with all that? Do you do some specific things, exercise? How do you keep yourself in good shape to be able to do all these things?
Yeah, many years ago, I understood that if I wanted to be an interventionalist for a long time, I would have to take care of my body. So I exercise almost every day. I work out at the gym, I bike, I run, play tennis, a lot of things, and I always find some time in my day to do a little exercise. If the weather is good, I go by bike to the hospital and to the office. So if I don't have time to go to the gym, that bike ride would have to do the work for that day.
Wonderful. So keeping very active. And have you had any back issues or any other issues, or are you doing okay with the lead and all these things that you?
Yeah, I had some back pains, but several years ago, and I do Pilates and physiotherapy, and then I started to do like exercise to prevent those injuries, because I think that the rate of back pain in interventionists is like 70 or 80%. So most of the guys will have at a point in life some problem. So we have to be prepared for that.
And what is your favorite? Do you have a favorite book or a favorite movie?
I like sci-fi, so my favorite movie is Blade Runner, the first Blade Runner, and I like also the music of the movie and those moments. I think it's a very good movie. And favorite book, I was very impressed by a book called The Lost Art of Healing from Bernard Law. This book is about the relationship between the doctor and the patient, and it was a book that I read like 3 times, and I was very impressed by his experience as a doctor and his human side, and understanding the patient and trying to help the patient, not to cure the patient, but to help the patient. I think that this is the most important message for me of being a doctor. You have always to try to help patients, not imagine that you are going to cure something, but you have to be prepared to serve, to help your patient.
Wonderful. And what are you most proud of? You've done so many things. What are the things that you are most proud of so far?
I'm very proud of my daughter. She is 15 years old, almost 15 now. She's a very beautiful girl. And I think that this endeavor, the Latam CTO registry, and also this all this initiative that we could put together so many people and help so many doctors to learn, do the procedures, so many patients, and publish a lot of articles and put Latin America on the map. I think that this is something that I'm very proud of. Also, my work as a doctor, I feel very proud of being a doctor.
Wonderful. And what excites you the most right now? What are the things that you see coming now or down the line that you're super excited about?
I'm very excited about the possibility of working without a lead apron with the hampered system. I'm very excited about the antegrade 3D wiring that the Japanese are developing. The possibility of doing most procedures antegrade. I think this is something that is coming, and I saw some videos, but for me it's very complicated yet. I could not fully understand how they can do that, but I saw them. I went to Japan in 2019 to the complex Congress intervention that they had there. I presented the Latam CTO there I was invited by Asahi to present our data there, and I see a lot of very, very difficult cases that are I was very impressed by their ability with a wire and how they can track the vessels antegrade. And I think that this new IVO system from Terumo that has a very short tip and the sensor near its tip, I think that it may change the field because we are getting better at retrograde and ADR, but I think that if you can do the job with the antegrade with a more easily approach, I think it would be better for the patient.
Wonderful. And then, so Alexandre, in here to give some advice to people. So the people who are getting into the field want to learn to do complex PCI or CTO PCI, based on what you've seen and you've done so far, what would be your advice for them about how to get to learn and do this in a good level?
Yeah, I think that reading your book is the first advice. We bought your book and gave to our fellows here. So your book is like their first job to read. You have a lot of very important points there, and I also learned a lot from your teaching points there. But I think that you have to study a lot, and you have to practice, and also be humble that you have to enter the procedure thinking about everything that can go wrong, and not only what will be what you believe that is going to be right. So get help. Always try to work with another guy, a partner that you trust, that it's like you can trust in a difficult situation. And be prepared in terms of also of equipment that you have to, maybe you have the need to use, and check always with the lab if they have all the equipment. Is very important, because here we don't have those CTO PCI cards like you have maybe at your lab or in Europe, that they have like a card that has all the equipment there. So here we have to ask for specific wires and balloons, and so it's important to plan for this.
Perfect. Yeah, great points. And as you said, very important to get the theoretical background. But end of the day, if you don't do this, this is going to work. And do you have any words of wisdom for when things don't go well, when things fail, or when complications happen? You know, some people get very demoralized and they kind of stop their programs, or they very hesitant to take new cases on. Any advice on how to overcome this so you can still keep on improving and learning and doing the best that you can do?
Yeah, I think that we have I'm in this field for 30 years, so I've seen a lot of things, and a lot of bad things, and also very good things. So if you are trying to do CTO PCI, you have to understand that you are going to fail. So you have to accept this. If you don't accept that failing is a part of the process, you cannot do CTO PCI, because even the best operator in the world will fail in 5% of the cases, or 10% or 2%, depending on the type of patients that you get. If you get only very tough cases, your rate of failure will be much higher. If you are going to do only JCTO scores of 0 and 1, you are going to have a success rate of 95, 99%. But I think that this is the most important point. Everyone fails. So you have to accept this. And for us, who are people that are very specialized and sometimes very proud of ourselves, and want to success in every case, it can be difficult, but you cannot give up in the first failure that you have. The most important point is try to do everything that you can to assure that your chance of success will be high, like preparing for the procedure, having the right equipment, a good team to help you, and then you have to accept your failures. I think this is something. It's not easy, but I think this is the main advice.
Wonderful. Well, again, Alex, thank you so much. Again, it was wonderful talking to you today. Congratulations on setting up an amazing network of a lot of operators and hospitals doing these procedures in Brazil and Latin America. We're very excited to see the more news and techniques and everything else that comes out of your group. And again, thank you so much, and so happy to work with you.
Thank you very much for inviting me. I'm here representing a lot of people, so it was a great honor for me to be here, and also thank you for recognizing our work here in Latin America and partnering with us in a lot of things. Thank you very much.
Thank you for listening to the Sensei podcast.